Jade. Good morning. My name is Stephanie. I'm going to be your nurse. This morning we're going to be doing a physical assessment. I'm going to be putting my hands on you and doing some palpation, some light and deep, so just let me know if you have any pain. And I'll also be putting my fingers on you and tapping you. It's called percussion, so same thing, let me know if you have any pain, okay? I'm going to close this for your privacy. And also wash my hands before I start. I previously took the patient's vital signs and height and weight, and we did her visual acuity test for her cranial nerve number 2, which is optic, and she has 20/30 vision with corrective lenses. I'm going to start with my cranial nerves. We're going to do cranial nerve number 1, olfactory. I'm going to have you close one of your nostrils and close your eyes and tell me what you smell with the other nostril. Okay?
Lemon. Lemon, yes, lemon. Close.
Okay.
Ooh, garlic.
Yep. Okay. Cranial nerve number 1, olfactory is intact. Number 2, optic, we figured out earlier is intact. We're going to do cranial nerve number 3, 4, and 6, which is oculomotor, trochlear, and abducens, and that's with the cardinal fields of gaze. So I just want you to follow my finger with your eyes, okay? Okay. Cranial nerves number 3, 4, and 6 are intact. We're going to do cranial nerve number 5, trigeminal. I want you to close your eyes and tell me when you feel this touching you. Okay, cranial nerve number 5, trigeminal is intact. Moving on to cranial nerve number 7, which is facial. Can you smile? Can you frown? Can you raise your eyebrows? Okay, cranial nerve number 7, facial is intact. Cranial nerve number 8, vagus, and then also hypoglossal. Can you take a drink for me? Okay, cranial nerve number 8 and 9 are intact. Sorry, glossopharyngeal, not hypoglossal. Cranial nerve number 10. Is glossopharyngeal. Can you stick your tongue out? Moving around. Okay. Cranial nerve number 10 is intact. Number 11 is accessory. Can you shrug your shoulders for me? Okay. Accessory nerve is intact. And cranial nerve number 12 is hypoglossal. Did we already do that one? Okay, I think this one where you stick out your tongue. Okay. Stick out your tongue. Alright, moving around. Thank you. Okay. I'm going to do her skin assessment now. Her skin is pink, warm, and dry. She's probably more tan than pink. She doesn't have any moles or anything abnormal or lesions. There's no tattoos. There's no edema noted bilaterally on her lower extremities or her upper. Her skin turgor is good. Her capillary reflex is less than 3 seconds in her fingers and in her toes. Okay. When she walked in, she had a good steady gait. There were no involuntary movements, no muscle spasms, no scoliotic deviations. She has good hygiene. Her hair is clean and soft, and she has no body odor noted. She's sort of dressed for the weather appropriately. Okay. I'm going to start with your head. Her head is normal cephalic. I'm going to palpate. Let me know if you feel any tenderness. There's no nodules noted. Okay. I feel your ears. There's no lesions or nodules noted on her ears. They are proportionate and symmetrical. Sorry. Her eyebrows and eyelashes are evenly distributed. There's no drooping or sagging of the eyelids. Her sclera is white. Her iris is brown. Her pupils are equal and reactive to light and accommodation. They went from a 3 millimeter to a 2 millimeter with the light. You look at your internal eye. I can see the macula. And look at your nose while I'm at it.
Sorry.
There is minimal drainage in her nostrils. It's pink and moist. I can see the middle and inferior turbinae. There's no nodules or lesions. Okay. Look in your ear. Okay. Her ear is a little bit red on the inside. I see her tympanic membrane is a pearly gray.
I'm just nervous.
Okay. I see the umbo and the manubrium, the short process, and her cone of light at 7 o'clock. There's no bulging of the tympanic membrane, just a little bit red.
Sorry, I get nervous when people do that.
And I would do the same bilaterally on her other ear. I'm going to go ahead and look in your eye with this. Set this to 0. Binoculars. There it is. Okay. I can see her red eye reflex in both eyes. Okay. Okay. I'm going to now look inside your mouth. Her lips are pink and moist. There's no cracking. See, her hard and soft palate are both intact. You stick out your tongue.
Let me put on some gloves.
I see you just ate breakfast. I'm not going to actually check her gag reflex, but this is where I would do it. Her uvula rises midline. Her tonsils are O2+. Alright, you stick your tongue out. There's no lesions or nodules or any abnormalities on her tongue. She's got few dental caries, 3 in the inferior and 2 in the superior. Are those all your own teeth? Okay. I also see her parotid ducts. Okay. So I'm going to now feel your sinuses. Let me know if you feel any. You'll feel a little bit of pressure, but let me know if you feel pain. Okay. These are her frontal sinuses and maxillary. Is there any pain there? Okay. I'm gonna do her lymph nodes. There's pre-auricular, occipital. Excuse me. Submandibular, submental, cervical, deep cervical chain. As your shoulders up. This is supraclavicular. Okay, any tenderness there? Okay. I'm also going to palpate for her thyroid. Okay, let me get your drink real quick. I'm going to have you drink this and turn your head to your right. Okay, her thyroid is non-palpable. Alright, I'm going to go ahead and listen to your breath sounds. Okay? Just take a deep breath in. Bronchial. Bronchial. Bronchial vesicular. Bronchial vesicular. 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 Listen to the back. Deep breath. Bronchial vesicular. Bronchial vesicular. 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 Okay, I'm going to listen to your heart since I have this on, okay? This is your pulmonic valve. Aortic. Mitral. Sorry. Tricuspid. Herb's point. Okay. Her breath sounds were clear bilaterally, anterior and posterior. Her chest is symmetrical in expansion. You take a deep breath in. Okay, bring it back. Okay, yep, everything's symmetrical. Okay, I'm going to be placing my fingers on you, and when I place them, I want you to say the words 99, and I'll be assessing for tactile firmness.
Okay. 99. 99. 99. 99. 99. 99. 99.
Okay. I'm going to listen for bruits. I should have done that. And I'm going to use the bell. Some way or another. Okay. Okay, no bruits are noted. I'm going to go ahead with the pulses. Her carotid is a 2+. Her brachial is a 2+ bilaterally. Radial is 2+. Femoral. Femoral is 2+. Her popliteal is 2+. Her anterior tibial or posterior tibial is 1+. And dorsal pedis is 1+. Alright, can I have you lay down, please? I'm going to be listening to some of your arteries and then your belly and then feeling on your belly, okay? Okay. We'll listen to her aorta. Her renal arteries. Hepatic. Now, I'm going to look at your abdomen. Her abdomen is smooth and flat. There's no masses that are noticeable before palpation. There's few striae. It's tan and warm. Okay, I'm going to listen to your bowel sounds. Okay, her bowel sounds are active in all 4 quadrants. I'm going to be pushing on your throat. Okay, tell me if you feel any pressure. Okay, there's no tenderness upon palpation, no masses noted. Okay, I'm going to be feeling for her liver, so can you take a deep breath in and then let out. When you let out, I'm going to feel in the rest of your liver, okay? Okay. There's no pain noted and no masses. Okay. I'm going to feel for your spleen just the same way. Deep breath in. Okay, no pain or tenderness on deep palpation. No masses noted. And I'm going to feel for your kidneys. Okay. Her left kidney is not palpable. And her right kidney is not palpable. Okay. Let's do your range of motion. Can you bend your up at the knee? Okay, now abduct it. Okay, and put it back. Okay, this one. And bring it out. Okay, and put it down. Can you rotate your ankles? Okay, there's no crepitus noted. She has good range of motion in her lower extremities. I'm gonna sit up. Can you reach your arms out? Back around in your wrists. Over your head. Okay, she has good range of motion in her. I want you to pull. Okay, push. Good strength against resistance. Push with your feet. Okay, she has good strength against resistance in her upper and lower extremities. Let's see. Oh, I'm gonna check for CVA tenderness. I'm just gonna tap this slightly on my hand, and you let me know if you feel any pain in your flank area. Okay? No. Okay. No CVA tenderness. I'll do your reflexes. Okay, her reflex in her right arm is a 2+. Reflexes are present. Yeah. Her reflexes on her lower extremities are 2+ and present. Okay, I'm going to do 2-point discrimination. Okay, I'm going to place 2 objects on your skin, far apart, and then as they get closer together, you let me know when it feels like just one. Okay, do it on your arm. Close your eyes. Okay, do it on your leg. Alright, now I'm going to assess your sense of sharp and dull touch, okay? So you tell me when I touch you if it's sharp or if it's dull. Sharp. Right to your ears. I didn't do the Rhine or the Weber test. With the Weber test, I'm going to strike this tuning fork and I'm going to place it on top of your skull. And I'm not wanting to know if you're feeling the vibrations. I'm wanting to know that you hear the sound moving. Okay, so you let me know when you start hearing it, and then let me know when it stops. Okay. Okay. Now for the Rhine test, I'm going to do the same thing, and I'm going to put it back here on your mastoid process, and you let me know you hear it in both ears and when it stops, okay? You hear it both ears? Okay. Okay, I want you to stand up. I'm going to assess your sense of balance. Okay, can you walk like just a straight line out here, toe to toe, one toe from the other? Okay. Good. Okay, now come back. And can you take your right heel and run it down your left leg? Okay. Take your left heel, run it down your right leg. Okay. Can you bend over and touch your toes? And I'm going to feel for any scoliotic deviations. Do you feel any pain or tenderness? Okay, her spine is straight and in alignment. There's no pain or tenderness, no masses. Okay. Um, yeah. Alright. Let me see if I forgot anything. Okay, for a breast exam, I'm not going to do it on her, but what we would do is I would have her sit up straight with her hands on her hips and would start at the outer edge and move up and down with my fingertips, feeling for any masses and looking for any indurations or lesions or any abnormalities. Would check the lymph nodes in her axilla, and there's the axillary lymph nodes, and then medial, and some other ones. For a rectal exam, I would wash my hands, put on gloves, have the patient lie in a prone position, and have some KY jelly, and just have them relax and insert one finger into the rectum and feel for any prostate enlargements. And that's it. We're done. That's all I can think of.